Hi everybody, welcome to my YouTube channel Dr. Sreenivas Medical Concepts and my FB page Dr. Sreenivas Concepts. This is Dr. Sreenivas, neurologist from Rajahmundry, Andhra Pradesh, India. I am also the medical author of the books Focused Neurology and Exam Oriented Clinical Neurology. My email is sreeklpm@gmail.com. Today we are going to talk about a very important topic, the MRI sequences in the diagnosis of stroke. So if a person comes with stroke, what are all the MRI sequences which will make the diagnosis of stroke easy? So continuing with the neuroimaging concepts, ischemic stroke part 24, MRI sequences in the diagnosis of stroke part 4. So these are all the MRI sequences in the diagnosis of stroke. The T1 weighted image is useful for subacute blood contusions and CSF disorders. The T2 weighted sequence is useful for infarction, cerebral infarctions, inflammations and tumor. The CSF appears bright, the liquids and edema, the solids and calcium are dark. The other sequence is the proton spin density sequence, which is bright for most pathology, and the fat water acute blood appears dark. But by and large, the sequence which we use commonly is the fluid attenuated inversion recovery sequence, the FLAIR, which is nothing but T2 sequence, but the CSF signal is suppressed, so CSF appears dark. So anything adjacent to CSF can be well made because the CSF appears dark. So it is good for edema and inflammation, gliosis. But if the person presents with stroke very early, the sequence which can pick up stroke very early is the diffusion weighted imaging. So it is useful for acute infarction. So any person who's coming with stroke, within few minutes, the best sequence is DWI, diffusion weighted imaging, which is very good for acute infarction. So the signal appears bright for acute ischemic stroke. So if you do DWI, it appears bright, but after several days it may appear dark blood after several days. But initially, as they present with stroke, the best sequence, MRI sequence for acute stroke is diffusion weighted imaging, DWI, and it appears bright. The acute ischemic stroke appears bright. The other sequences are susceptibility sequence. This sequence very useful for hemorrhages and calcification, and the hemorrhages, they appear dark, the blood appears dark. The other sequence is the short tau inversion recovery, that is STIR, which is very useful for spine and orbit studies because it eliminates fat signals. So STIR. So the best sequence for diagnosis of stroke, especially acute stroke, is the diffusion weighted imaging, DWI, which is very good for acute infarction, and the signal appears, acute ischemic stroke, the signal appears bright. So the best sequence for diagnosis of stroke, especially early stroke, is DWI. So these are the important concepts of the MRI sequences of stroke. The other important concepts of clinical neurology I put in a book called Exam Oriented Clinical Neurology. All clinical neurology concepts. This book will be very useful for students appearing for clinical neurology exams. The other important book I've written is Focused Neurology. I put the entire neurology in a question and answer format. This book is available online from all leading booksellers, including Amazon. This book will be very useful for students appearing for oral exams, and if interested, this book could be purchased online, especially Amazon. So I hope you have enjoyed listening to these wonderful concepts of MRI sequences of stroke. If you have enjoyed it, please like and share the link. But please subscribe to my YouTube channel, Dr. Sreenivas Medical Concepts, which is India's leading neurology educational YouTube channel, and my FB page, Dr. Sreenivas Concepts. Thank you. Bye.